And now it's time to meet our outstanding CIO of a company with more than $1 million in revenue. Please welcome Tom Martin. Tom is Chief Information Officer at Evergreen Health. He was born in Seattle and raised in Washougal. He earned degrees in math and business from the University of Portland. Tom's career path has taken him from Burroughs Corporation to Anderson Consulting to UW Medicine before joining Evergreen in 2006. Evergreen serves nearly 850,000 people in King and Snohomish counties, has more than 3,000 employees, and revenue of more than $1.2 billion. Tom is guiding the healthcare provider through a period of significant growth and change. He played a key role in Evergreen Health becoming the first hospital system in the Puget Sound region to win Stage 2 certification from the Centers for Medicare and Medicaid Services for their meaningful use of electronic records to improve healthcare. In addition to his role as CIO, Tom's business background comes in handy since he also serves as Evergreen's Senior Vice President of Strategic Planning and Business Development. In this role, he leads acquisitions and partnerships, including those with Virginia Mason, Seattle Cancer Care Alliance, Valley General Hospital, and Puget Sound High Value Network. His first computer was an HP, and he first wrote code when he was 18. His first career job was as a systems engineer at Burroughs. That's Tom Martin.
You told us that the transition to electronic medical records is actually making a huge difference in the care process. Tell us a little bit about how you think that will continue to make a difference.
Sure. I guess every day, each of us wants to come to work and know that the work you do makes a difference. And so, as we think about electronic records, imagine being a caregiver for your senior parent. We have a clinic that serves complex patients that are elderly, have multiple problems, complex medication requirements. And we capture the data about them. If we have to make a referral to a pulmonologist if they have a complexity, we know that that information is going to be available to that person, to that physician. And then if your loved one gets very sick, they show up in the emergency room, we have all the information at the bedside for the physician to have to provide the care. So it's about sharing information. So we know that happens every day and it works. The most interesting thing though recently is we're able to take data about patients that are in the hospital and analyze it real time and understand if a patient is deteriorating. And so we actually will page someone to the bedside about 15 to 20 times a day, different across the hospital. We have roughly 200 patients in the house each day. And about 10% of the time, we'll actually change the level of care for that patient because the system is able to detect a deterioration in that patient. So it really does make a difference, and we think that the care is getting better.
That's great. So we also want to know from everybody, what inspired you to pursue an IT career, and what advice do you have for others?
It was the only job offer I got out of school. So not very inspirational. I did get real inspiration with my next job. I went to work at Anderson Consulting, and I learned a lot there. I learned about some of what Chuck talked about. In fact, Chuck was one of my mentors at Anderson Consulting, so he truly is a lifetime achiever. The tie between strategy and the value of information is a strategic asset was something I learned there, and that was inspirational and led me to other things. And my other mentor, Mark Ardiet, here brought me into healthcare, so I appreciate the opportunities you gave me. As far as what you would do if I were going to ITB, I'd ask you this question: do you like to score touchdowns or do you like to block and tackle? Because it's really, if you're like to score touchdowns, you want to go work for a tech company where it's going to be about what you deliver is the product. If you're an offensive lineman, go work at a service industry where you're in the background, you're doing those things that make things work every day. And you don't get the accolades, but it's important work and people appreciate it.